Hello, I'm Dr. Amy Russell from the University of Leeds. I'm here to present part 3 of the 4-part training module, How to Make Reasonable Adjustments to Diabetes Care for People with a Learning Disability. This part focuses on getting it right during Covid-19. As you can imagine, when we began this project, we had no idea we'd have a need for this module, and in our original face-to-face training, we didn't have it. But now more than ever, we need people to think about making reasonable adjustments in light of Covid-19. The health inequalities that people with a learning disability were already experiencing have been exacerbated by this pandemic. We know that a lot of people with learning disabilities are frightened and are shielding and are socially isolated, and we need to think about their healthcare and how we can make changes to it to help them. Now, don't get me wrong, I understand that in clinical life we are so under pressure and we want to do our best, but sometimes it feels ridiculous. So I'm here to tell you what we need to do, what we have to do, and give you advice how to make that easier, hopefully not making your lives harder. So I'm going to share my screen so you can see the slides that form part of this training. So we're going to look at common worries for people with a learning disability, diabetes and Covid-19, and answering the question, it's not possible to make reasonable adjustments right now, is it? And I think you can guess what my answer is. So Covid-19 and learning disability. So we're seeing some really awful data come out of the morbidity data for Covid-19. We're seeing that people with a learning disability are between 4 and 6 times more likely to die from Covid-19 than the general population. We're seeing certain groups of people, like people with Down syndrome, are even more likely than that. And we actually suspect that these numbers are underrepresenting the risk to people with a learning disability because of how poor coding is. I've seen some absolutely terrifying numbers for 18 to 30-year-olds who have a learning disability and their mortality rates that I've not cited here because it's quite new data. But one thing I can tell you is that having a learning disability makes you extremely vulnerable to Covid-19 and to negative outcomes. And even without this knowledge, which we're gaining as the pandemic goes on, people with learning disabilities are confused and frightened. A lot of them have told me that they don't know that the doctors is still open, and they think that they shouldn't bother the doctor because they're busy with people with Covid-19. And so they haven't been calling, even though some of them are getting worrying symptoms or they're feeling like their diabetes is out of control. I know that on the majority, on the whole, you're doing really well continuing with routine care. But I think some people might be slipping through the net, and this is what we want to address. Masks for some people might be unavailable. They don't know where to get them. They don't realise that if they don't have one, you might be able to give them one. They might tell you they can't come to an appointment because they think they're not allowed because they don't have a mask. And for people with sensory issues, masks may be extremely problematic. They may feel quite overwhelmed, like they're unable to breathe, or simply wearing a mask, even though they'll tolerate it, may take up such a large percentage of their thoughts and experiences that they find communicating and wearing a mask a real challenge. So please do think about mask wearing as not something people are being difficult about, but actually they are experiencing it as potentially very problematic. A lot of people are very unclear about who can travel, where and when. They might not know that a trip to their GP is essential travel and that they're allowed to do it, and they might be frightened they're going to be stopped by the police and fined. And you need to talk to them. If you're going to get them in for an appointment, talk to them about how they're going to get to you and if they understand that they're allowed to get to you and when they're going to come to you. These are practical discussions you need to have with somebody because they may actually leave you with a DNA if you don't have this conversation. Somebody might panic or worry, or they might be planning to come to you because you've asked them to, but actually really stressing about it because they don't realise they're allowed. I should also say that this Covid-19 image is one from Easy on the Eye, who you can access through the Get Checked Out Leeds website, and they're at Leeds and York Partnership Foundation Trust, and all their images are free to download. So if you want to make any information for your parents, please, patients, sorry, please do use those if you want them. So for a lot of people with a learning disability, support is limited. When we realised that carers might be transferring COVID between different people that they were supporting, a lot of people cancelled the carers coming in to their family members, and some people got fearful and cancelled their own care. Then, of course, your care population, your workers are off ill, they're shielding, there's not enough of them. So somebody who only had a few hours a week of support may not have seen anyone for several weeks, if not longer now. So people are experiencing social isolation. They may not be getting anyone to read their letters. Bills may be mounting up. They may be getting in serious trouble at the moment, and health letters, appointment letters may be part of that. So one reasonable adjustment is to make phone calls to people, to check in on them, to check they got your letter, to find out what their plans are. As I said, public transport now is a space of fear for a lot of people. A lot of people with a learning disability used to rely on their free bus pass and travel after 9:30. And now they're really afraid that they're going to catch something on public transport. And they don't know if they're allowed to get on it and if they're going to be given a quiz on their intentions when they do get on public transport. It's obviously their choice if they want to come in and have a face-to-face appointment. And you shouldn't be forcing anybody or treating it as a kind of neutral choice for them. You should be discussing it to give them an informed decision on whether they want to come in or not. Some people face digital exclusion. The people I met in our project where we interviewed people with type 2 diabetes and a learning disability, many of them didn't have mobile phones, and those who did rarely had smartphones. And then you had a small proportion who were really whizzy, and they could FaceTime you, and they could go on Zoom and everything else. And increasingly, I'm meeting people with a learning disability who've been supported to use video chatting facilities. But I am still very aware that they are a small proportion of the population with a learning disability, and the majority don't have phones, don't have data, don't have ways of communicating beyond maybe having a telephone, which they may struggle to communicate over. For a lot of people, visual cues are really important for communication. They need to see your smile to be reassured that you're not angry at them when they're struggling to understand you, or that the message you're conveying to them is something you're okay talking about. You're not telling them off because their blood sugar's high. If you can't take your mask down or wear a visor, and that is, completely okay, then think about using your words to replace the visual cues you might have given them before. And this is really important because it's not something that we have learned to do because this happens so quickly. But with this population, they rely heavily on visual cues for communication because words can be quite overwhelming. So you need to adapt the way you talk, actually slow it down, give breaks, and use those words to reinforce the smiles and the reassurance that you would have given them in other ways before. And just to emphasize that a milder learning disability does not mean that a person needs less support or is at less risk. In actual fact, if you've got somebody who has a more severe learning disability who's living with 24/7 care, then changes in their health, in their toileting, something like that, may be noticed. If you've got somebody who normally had 2 hours a week support, but 4 weeks has gone by without anybody coming, and now that person arrives to, from an organisation, and they've got bills to pay, letters to answer, supermarket shop to do, they've got to trudge through the snow, they are not going to start going into the strange abdominal pains that such and such has been having for weeks, or the extra thirst, or, anything really that is a smaller indicator of physical change. So these are the people that you actually need to be reaching out to check in on them. So diabetes and COVID-19. People who have diabetes have an increased risk of serious illness, and people who have a learning disability have an increased risk of serious illness. If you combine those two, you can imagine that people with a learning disability who have diabetes are really afraid. Check the sick day rules for that person. Do they understand? Do they know what that even means? So many people I meet have no idea what they should do if they're poorly and on diabetes medication. Do you have some information for them that you could give to them? Could you write them a personalised plan? Now, what I don't do in this session is I don't go into details because everybody's medication is different. Everybody's blood sugar has been different over time, and you really need to look at that individual and make a plan with them, a personalised plan that they can take away, and you need to reinforce those messages to them. When I get home, I will check that I have enough prescription for the next month. If I start to feel ill, I will think about who will they tell? What will they take? What will they do about their medication? Will they stop it? Will they reduce it? Will they call you and let you know, and you'll make a decision together based on their symptoms? This is a really complicated discussion to have and may actually take a whole appointment just to establish what their sick day rules are. But if you don't and they get ill, it could have serious consequences. So please do talk to them about what they should do if they get ill and they have diabetes. Make a plan with this person. Agree, what are they going to drink to stay hydrated? This is a big one because a lot of people will go straight back to Coca-Cola or Lucozade if they're feeling poorly. So talk to them about what the right thing is, the importance of staying hydrated, but don't stop there because that just means litres of Lucozade. Talk about what should be drunk. Have they got enough prescription? Have they got test strips, lancets, whatever they need? And if not, could you order a prescription for them now? Do they know when they should be asking for help? And do they know who to ask for help and in what situation? And I would say a lot of times people don't. And again, they don't want to trouble you. They know there's a pandemic on. They don't want to bother anyone. And again, if you're worried about how somebody's coping because they're telling you their supporters not coming anymore, they haven't seen anybody, or that they don't have enough prescription and they can't get to the chemist, please do think about some joined up working. Think about your health facilitation team, your community learning disability team, talking to their support workers and to their family and trying to figure out something together to avoid a crisis or a sudden admission to A&E that could have been avoided. And please do signpost them. Remind them the doctors are still open and they're still there for them. Tell them when it's appropriate to call 111 and that nobody will tell them off for doing that. Find out a named supporter and record that name and work as a team with that person if you need to. If you happen to actually get them there in person, get a plan with them as well. And tell the person about the Diabetes UK helpline, which is really important because again, because it's slightly removed from the doctors, they might be more comfortable calling them as a first step, and that helpline can signpost again. So now more than ever, we need to code correctly so that if one of our patients is suddenly admitted into hospital, it is flagged that they have a learning disability, flagged that they have diabetes, and they will get the support they need for that. We need to give double appointments. Imagine trying to get through your sick day rules in a short appointment. It's never going to work. And telephone appointments might seem often like a quicker alternative, but I think we've all found out they're not. So do remember double appointments for telephones as well as face-to-face. Get to know your support network for that person, their supporters, who they see, when they see them. Adapt your communication for the fact that they can't read your visual cues anymore. And build a network of support. If you're worried about one of your patients falling through the net, then you need to seek support for them. And this is the right time. These teams like health facilitation are extremely sympathetic to this, and they will help you support them. So thank you for listening to this part of the 4 training modules on COVID-19, diabetes care and learning disability. Any comments and questions, please do get in touch. And I do hope that you go on to listen to the final session of these 4 training modules.